Following nearly a century of conflict and a long period of international isolation, Pathfinder was the first reproductive health NGO to post staff in Vietnam. Prior to Vietnam's shift to a market economy in the late 80s, the country had little development in health services. Clinics were often degraded, there was a lack of medical education, and little importance was given to the quality of patient care. Through close working relationships with the Ministry of Health, regional universities, and local service providers, Pathfinder has supported significant improvements throughout Vietnam's reproductive health care system. For many years, medical education in Vietnam was inadequate. The majority of medical students had little opportunity for hands-on clinical training or direct patient interaction. New doctors entered hospitals unprepared to offer the depth of patient care needed to serve this rapidly growing country.
The students are learning mostly related to the theories, and they don't have enough opportunity to practice clinical skill. And curriculums are sometimes very out of date and not yet updated. And the teachers usually use a traditional method that not motivate the students' learning.
Pathfinder has supported local universities in developing improved curriculums for medical education, such as field teaching programs where students can practice clinical skills and improve their counseling methods by actually working with patients.
Now students also can participate and in small group, and it is very relevant with the clinical settings, especially to facilitate more participation from students. They call active teaching or active learning, so students have more chance to express their ideas.
This level of training is essential, particularly in a country with one of the highest abortion rates in the world, with over 1.4 million abortions conducted annually. It is vital that women have quality counseling about the various forms of birth control and also have access to those services from educated providers.
Anyway, the client will try to seek abortion, and then in that case, she has to go outside to the private setting, and then in that case, will not have seek abortion. They prefer to go to private clinics due to first they think that it's more confidential, and then the volume of clients in public sector is normally more than private. So they are not so afraid to be seen by other people.
Especially for populations such as youth that seek anonymity, it is essential that they feel comfortable accessing these services at safe and competent hospitals.
Cultural norm, they think that yes, we cannot have sexual activity before marriage, getting married. It's still in the mind of a lot of Vietnamese people, even the service providers. So we have to train them how to deal with youth.
Pathfinder has worked with the public hospitals to encourage young people to seek reproductive services in a more healthy way. To improve privacy, the hospitals have constructed private reception rooms separate from the adults and offer friendly, non-judgmental counseling so that young people can feel comfortable discussing their reproductive health needs. Since these improved standards of reproductive health were developed by the Vietnamese themselves, the programs are now trusted to be replicated throughout Vietnam, including the less regulated private sector and remote regions of the country. With this sense of ownership, there is also an ongoing collaboration with domestic and international universities for continued improvements in medical education.
So they work together and share experience among lecturers, not only from Haiphong but Hanoi, Thái Nguyên, and other. We have 8 medical universities, and then they exchange experience. They learn from each other and networking to each other.
For Pathfinder in Vietnam, this is a very, very exciting time. There are very important changes happening in Vietnam right now. In particular, you can see the incredible social development and economic growth that's happening right now. We see a tremendous openness to new ways of working. experiences with the government and our relationship in working with the government, we have a lot of exciting new opportunities to translate our work into policy. And that's a very important transition, because what it means is that we can sustain our programs. We feel very privileged in our working relationships with government and in our ability to really do effective development work in this context.
Người về